One of the things that I try to make my practice be different is in prevention. I wanted my practice to focus on preventing cardiovascular disease, identifying cardiovascular disease before you suffer a heart attack. How do you know that you have cardiovascular disease? We know that sedentary life causes a lot of medical problems, including obesity, diabetes, high blood pressure, cholesterol problems. So we try to encourage our patients to exercise in order to reduce the risk factor for developing any of those problems. Granted, if you're active, your chances of developing cardiovascular disease is lower, but inactivity is not the only risk factor. We know that high blood pressure has been related to cardiovascular disease. High blood pressure is the easiest preventable cause for cardiovascular disease. That's why we are so emphatic about screening for high blood pressure, treating high blood pressure, because we know that it's so simple to identify and to treat. Nutrition plays a significant role in cardiovascular health. When we're talking about cardiac diet, for example, the American Heart Association recommends the DASH diet, which is a diet to target blood pressure to help reduce blood pressure or prevent hypertension. Essentially what it is a diet that is rich in fruits and vegetables, grain, and lean meats, mostly emphasizing poultry, fish, less red meat. You probably have heard about Mediterranean diet. People say, why is such a big thing about the Mediterranean diet? It's basically because it's very rich on the good unsaturated fat. When it comes to lifestyle, we know that excess of alcohol raises your blood pressure, which is one risk factor for cardiovascular disease. Smoking is the most preventable problem for cardiovascular problems. So if you smoke, you're at risk for cardiovascular disease. So tips that I can give you. If you don't know you're at risk for cardiovascular disease, think about how old are you, how much do you weigh? When was the last time you saw a doctor? Do you know your cholesterol numbers? A checkup a year can save your life. And don't think that because you don't have symptoms, that might not be something that can be developed.